Hi Sarah, I'm Ashley. I'm one of the nurse practitioner students. Today we're going to do your abdominal assessment and we're just going to do some blood vessel assessments.
Okay.
That's okay with you?
Mm-hmm.
Okay. So for part of this exam, I am going to have you pull your shirt up a little bit just so we can inspect and examine your abdomen.
Okay.
First, we will start with the blood vessels. So what I'll do is I'm just going to palpate your lower extremities, check for your pulses in the lower extremities here.
Okay.
So just going to check them both bilaterally here. The dorsalis pedalis pulse. Dorsalis pedal pulse, sorry. And then posterior tibialis. Good. Those are good, within normal, both regular. Your refill, capillary refill on your toes, all are good. Then I'm going to listen for any bruits in the abdominal aorta. You can keep it down for now. The abdominal aorta, the renal arteries, the iliac, and the femoral arteries first. So we'll listen, like I said, for the bruits there. I'm going to check first your carotid. If you can just hold your breath briefly. Good. You can breathe. All right, now I'm just going to pull your shirt up a little bit. Okay, so first I'm listening for your abdominal aorta. You can hold your breath again. Good, you can breathe. And then renal arteries. Go ahead and hold your breath again. It's iliac. And then femoral. Good, you can breathe. Okay, and then while I'm have your shirt up, I'm just taking a peek at your abdomen, inspecting, making sure skin color looks good, and that all looks good. I don't see any lesions, scratches, scarring, anything like that. The next thing I'm gonna do is have you just raise your head a little bit forward just so I can check your muscles here. Good, perfect. Now you can lay back down. And then I'm gonna first listen to all quadrants of your abdomen here. We start in the right lower quadrant. And then the right upper. Left upper. And left lower. Good, perfect. Hyperactive bowel sounds, but I think that's because you said you were hungry. Okay, perfect. So then the next thing, so we listened for the bruits and the arteries of your abdomen. The next thing we're gonna do is percuss all quadrants. So let's go ahead and do that. I'm just gonna pull your pants down a little bit here. Any pain when I'm doing that?
Mm-mm.
Okay. And then I'm just going to use light palpation here. Any pain or tenderness feeling?
Mm-mm.
Okay, good. And then we're just going to do a little bit deeper of a palpation, feeling for any lymph nodes or masses. That was a loud growl.
I'm so hungry.
Alrighty. Only thing I'm going to note is that there are just a few little lymph nodes, it feels like, around the umbilicus that might be a little swollen here. And then I'm going to also just palpate up here underneath where the liver border is, up under the right rib. So I'm gonna put my hand underneath you here and just feel for your liver border, which should be underneath the right rib cage. Take a deep breath. Good, okay. And then palpating over the gallbladder, spleen. Good, and I don't feel any different pulsations, no masses, nothing like that. And then I'm just going to also now ask you to sit up for me. I can help you here. Okay, so while you're sitting up, I'm just going to check for any kidney tenderness back here when I check your, I'm gonna percuss your crossovertebral angles here. Any pain as I'm doing this?
No, you just burped me.
Oh, okay. All right, perfect. Okay. So that takes care of our abdominal assessment. Okay, thank you.
Thank you.